Welcome to the series of Ask Us Anything. I want to introduce myself. I'm Dr. Achina Stein from Functional Mind, and Vin Patronelli. He is a nurse practitioner who's joined this practice, and we decided we wanted to get to have him get to know you and you get to know him. So we decided to do this series of Ask Us Anything, and we had a great response. We have at least 5 questions, and they're pretty heavy questions. I'm even hoping that we can get through all of the questions, but we're going to start right away and I'll start reading them. But I did want to first say that this recording is purely educational and it's not intended to create a doctor-patient or nurse practitioner-patient relationship or provide personal medical advice. So every person's situation is different. So please work with your own healthcare provider before making any changes to your medications, supplements, diet, or treatment plans. If symptoms are severe, sudden, or worsening, please seek urgent medical care. So thank you for that. This is purely educational, and we're happy to provide this information to you. I'm going to start with the very first question. It's a very broad question, but it's certainly worth asking. I'm going to just say that the initials, so that we can keep track of who asked what questions, the initials of the person is BS. I'd appreciate an introduction and overview of our hormones, including topics like how they interact with each other, interface with diet, and other metabolic factors, symptoms of hormonal issues, and any other things we should probably all probably should be paying attention to. Easy to do, high reward actions and habits we should probably all be doing as well would be helpful. I don't really have any specific questions, but I'd very much prefer to get your holistic views on this instead of poking around YouTube or doing AI queries. Thank you. Thank you, thank you, thank you. So I know, Vin, you said you wanted to take this question, and so go right ahead.
I'm happy to. Yes, and thank you everybody for viewing this. Hopefully that this will provide some insight. This question, we could do a webinar series on hormones and how they all interact. I'll try to boil it down a little bit here. So I like to think of hormones sort of as like an orchestra in a symphony where they're all sort of working together. And if one is a little bit unbalanced or there's an issue, it can throw some things off. So your body will generally prioritize some of your survival hormones over your reproductive hormones. So things like cortisol and insulin, your body's going to prioritize those first, over things like your thyroid hormones, and then definitely over things like your reproductive hormones. And not everybody is different, or not everybody is the same. So
Right.
it doesn't always work exactly that way. But I can certainly say from my experience that I certainly see that stress hormones and insulin hormones that are related to metabolic function can certainly impact our reproductive hormones and sexual hormones. So um, things like cortisol, for example, which we all know is a stress hormone, I often see in practice that very healthy, happy, high functioning people that have very busy jobs, that are exercising, can still have issues with their reproductive hormones just by issues with cortisol and stress. And that stress can certainly come in a lot of different forms and varieties. I have people that are high functioning athletes that overtrain, and so they're overstressing the system. I have
Right.
people that are not really moving at all, and cause some other issues from a metabolic standpoint. But you know, there are differences between hormone shifts that occur because of lifestyle management, versus shifts that occur naturally with aging. So I just want to make that distinction. Um, so, if we're sort of taking out the piece of hormonal changes that occur, things like perimenopause and menopause, just regular sort of hormone balances, we need to make sure that we first address our pillars of health. So to kind of address that second part of the question of things that we all should be doing,
Right.
number one is trying to address the making sure that we're having a well-balanced meal, adequate amount of proteins, dietary fibers, micronutrients, um, making sure that we're getting in movement to some degree. And granted, overtraining can certainly be a problem. I see hormonal imbalances with people that like are training for marathons or CrossFitters that are just doing CrossFit like every single day or two a day type activity. Um, those are different levels of stress. Sleep deprivation can be a really common factor when it comes to hormone balancing. Those are some of the basic pillars that we want to make sure that we're addressing if we're going to try to balance hormones.
Right. Yeah, so I think it would be helpful to just zoom out a little bit and just talk about what hormones are in play. There's a whole group of hormones, and sometimes people make the mistake of treating hormones like they're independent switches. And so the types of hormones that we're talking about, a lot of times when people think hormones, they just think about sex hormones, which is estrogen, progesterone, testosterone, DHEA, LH, and FSH. But the other hormones that are in play are your stress hormones, like you've been mentioning, like cortisol and adrenaline. And then there's thyroid hormone, which covers so many areas of the body. And then there's the blood sugar and metabolic hormones like insulin, glucagon, leptin, ghrelin, and adiponectin, many of which we test for. And then there's those minor hormones, the gut and immune and circadian hormones as well. So melatonin, gut peptides, inflammatory cytokines, microbiome derived compounds, and circadian rhythm. And the thing is, they all interact with each other like an orchestra. That's the piece that people need to, I think, understand. And something like blood sugar regulation, what can you do? You can regulate your blood sugar, you can get really good sleep. It's really focusing on those foundational areas that, and fine tuning and really working hard to get those things in order.
100%. Um, there's so many different factors when it comes to the hormone component. And yeah, a little, that little organ, that thyroid gland is often overlooked as a big part of what's driving some issues. Sometimes it's centrally from the thyroid. We can have or develop something like a little bit of hypothyroid or Hashimoto's. Sometimes other pieces of our health are impacting the thyroid. So the thyroid then kind of comes secondary, but impacts some of the reproductive hormones. So what we like to do in functional medicine is really identify where the root cause is coming from. Is it truly a thyroid component that's driving everything, or is it some of these other factors that could be impacting the thyroid that's then downstream causing other hormone imbalances? I had a patient that if you looked at just her regular blood work, it would be, based on her complaint, she had a little bit of fatigue, a little bit of like a low libido. And if you just looked at basic blood work that you get when you go to your PCP, it looked like it would be very easy to just say, oh, let's just put this person on testosterone, for example, and try to boost up their libido. But when we really looked at some of the more in-depth testing, either through like a Dutch test or a ZRT test or something like that, um, we were able to really identify that it was actually the thyroid that was driving things more so. So we saw some cortisol or issues with cortisol clearance, which was then impacting the thyroid. Um, so basically, at the end of the day, we did some adaptogens and really regulated her thyroid, which then helped regulate a lot of her reproductive hormones. So getting to the root cause is really, really, really important when it comes to balancing hormones.
Absolutely, absolutely. Yeah, I think we covered a lot right there. I probably the piece that we may not have mentioned is how where the hormones begin. They begin in the brain. So in the pituitary gland primarily, a lot of the hormones begin in the brain, and then they send signals to the different organs, whether they be the thyroid, the adrenals, or the sex organs. And those are just the major ones. We're not talking about the gut here. But sometimes the testing that conventional doctors do, they just test to see if the brain is releasing those hormones. And then there's this assumption, and I'm thinking the thyroid specifically, a lot of testing done by conventional doctors only includes the TSH, which is the thyroid stimulating hormone sent from the pituitary gland. And that goes to the thyroid and says release T3, T4, which then gets activated into T3. So there's a total T3, a total T4, a free T3, and a free T4. There's even a reverse T3. And many times the conventional doctors do not order those labs. Some of them may order just a total T4 and a T3 uptake, which is no longer useful.
Mm.
But anyway, it's really important to get the whole gambit because there are certain minerals and vitamins that the thyroid needs in order to make that conversion. So sometimes people are put on thyroid medications and it's not working. And that thyroid medication, if it is levothyroxine, it's synthetic T4. But if your body's not able to convert it because it doesn't have the right amount of zinc and selenium and B vitamins, iron. There's a whole host of vitamins and minerals that are needed to make that conversion. So if that conversion is not occurring, we need to know about it. How do we know about it? By getting those labs. And sometimes people are put on thyroid medication and it's not really the right treatment because they might be trying something, but it will convert the T4 into reverse T3 and actually put you in hibernation. And when we get that lab, that might actually tell us that that's like the wrong thing to do, but also tell us like what the body really wants to do is rest. It's a way to also know that you are pushing your body way too hard. It's getting that reverse T3, whether it's external or internal. But
Just
yeah.
just to provide a little bit of context to that too, there's just to give people a little bit of information about the T3, T4, and reverse T3. So I think you did a great breakdown of that. And just to give people context, a simple way of thinking about it is that our T3 is in some ways like the gas pedal, and reverse T3 to some degree is like the brake pedal. So to bring it back to your point, if you have too much conversion from T3 or free T3 to reverse T3, what's going to happen is you're going to have too much of that brake pedal. And that's where sometimes people get fatigue or brain fog and some of those sort of symptoms. And it's just because you might have your TSH looking okay, your T3 looks okay, but too much of that T4 is getting converted over into the reverse T3 instead of T3, and you're getting more of the brake pedal and you're starting to slow down a little bit. Um, Additionally, some of the conventional medications that we use, although they are certainly by the guidelines and they're certainly appropriate, some people do better with some of these others, like Armour Thyroid, which has a little bit more of a T3 component. I had a patient that I had on Armour Thyroid, and just because of cost, she was like, "Oh, can we try one of the others and we'll try levothyroxine? It's covered by insurance." And I said, "Of course." So we got them on to levothyroxine or Synthroid, and over the course of the next 90 days, she came back and was like, "I just don't feel right. I can't put my finger on it." And so I retested her thyroid and I said, "I think your T3 is just too low, and I think that you were just doing better." So we got her back on the Armour Thyroid just to give her a little bit more T3 support, and she felt so much better within like 30 days. So really doing those advanced markers that you're not really going to get at your primary care can be really important.
Right, right. Yeah, so let's try to wrap up this particular question, but I think the most important section is dietary and metabolic factors and what are some easy, high reward habits that, they can do. And this person was probably already told because he's a patient of mine. So, eat protein at breakfast, making sure you're getting enough protein, especially at breakfast. You want to walk after meals. That's the best time to sort of use up that blood sugar that is floating around. And then if you're more on the ketogenic diet, that's a great way to actually put yourself into ketosis. Prioritizing sleep timing, like I said, getting first morning light, really, really important. That gets your circadian rhythm back in line. strength training, but not overtraining, like you mentioned. One piece that people don't realize is alcohol. Alcohol throws your blood sugars off bad, real bad. Alcohol is a poison. Sorry, it's a poison. So you're really limiting, or even, I mean, I think it should be discontinued in certain populations, especially if you are taking hormones. If you're on estradiol, you should not be drinking alcohol because it really affects your liver on multiple levels because of that interaction. Just like estradiol and smoking. If you're a smoker, you should not be on estradiol. So don't skip meals, build that nervous system recovery, which is, through breath work and, somatic, using your somatic tools and meditation, having downtime. If it's not even meditation, downtime, making sure you're moving your bowels. And, you don't really want to chase the hormones. Like if your hormones, like especially the thyroid, going up and down, up and down, and up and down, it's usually something like blood sugars that will cause that if your blood sugars are up and down. So I've had patients who've gone to doctors and multiple doctors because they couldn't find the right dose of medication, right? And it's not the dose that's the problem. It's the blood sugars. These hormones are they're signaling to you something's wrong. So you have to figure out what's going on that's causing my hormones to go up and down. You don't want to chase that lab value, basically. So I think I
Uh,
covered everything, I think. Anything that stand out for you, Vin?
just the last couple of pieces, just to add in a little bit of nuance with regards to the exercise. If, obviously we want people exercising. There is no medication that's more powerful than regular exercise. That's been clearly defined in the literature and just in life. I think we know that. Uh,
Mm-hmm.
for those who are struggling to get movement in, I think it's important to know that there's a very small amount of exercise that it really takes to move the needle. So doing a 20-25 minute walk after meals is a really good way to get moving. But even doing something for just 5 to 7 minutes a day is enough to move the needle to improve those metabolic factors. So
Mm-hmm.
things like, I work with a lot of people who are parents and have kids, and they're like, I can't get to the gym for an hour and a half, this whole process. And I'm like, well, what do you have? They're like, well, I have this like set of dumbbells at home. And I'm like, great. So you can do a workout either with dumbbells or without dumbbells, with body weights, just for 5 to 7 minutes. Do 5 minutes of burpees and tell me how you feel after that.
Mm-hmm.
Or my CrossFitters out there, something like a 21-15-9 rep scheme where you do 21 air squats, 21 push-ups, and then 15 air squats, 15 push-ups, and 9 air squats and 9 push-ups. It's a 3 to 5 minute workout, but it can really get your heart rate up and doesn't take a whole lot of time. So get the kids involved. They mimic what they see. If they see mom and dad moving, they're more apt to be active adults as well. So just get in a little bit of movement. But yes, just 5 to 7 minutes of a little workout like that, a few times a week, mixed in with just a short walk can really move the needle in the right direction.
All right. So someone wrote head injury confusion, especially with stress. What is the functional medicine approach? Thank you. So that's again another broad topic. So a head injury can absolutely like leave someone more vulnerable to confusion, brain fog, emotional overwhelm, and trouble thinking clearly, especially under stress. So the one way I explain it is this. And so after a concussion, or what we call a traumatic brain injury, the brain might look normal on scans, but it may not have the same reserve it used to have. So the person might seem okay on a calm day, but when the stress hits, they get too much noise. Like if it's too much noise, too many decisions, not enough sleep, conflict, you didn't eat, that day, like you normally do, or you have pain, like the brain gets this overload and it just overloads much faster. It doesn't have that resilience anymore. So, from a functional medicine standpoint, we don't ask like what happened to the head. we ask the question, what is making the brain less resilient now? So I just want to back up. If there's a head injury, you just want, the first thing you need to do is look at safety. So if this confusion is new or it's worsening, it's sudden, you absolutely want to see a medical provider and get evaluated and make sure this isn't very, very serious. Something very serious absolutely needs urgent medical care. So, but if this is like a lingering pattern after a head injury, then it's like multiple layers that you need to deal with. And so sleep is huge. The brain absolutely needs to sleep in order to repair. And the most important times to be asleep is actually from 10 p.m. to 2 a.m. Really, really important to get to bed very early and doing absolutely everything you can to get that sleep. And blood sugar is, again, mentioning blood sugars again. So blood sugar is really, really important. You don't want to skip meals. You don't want to eat a lot of sugar or drink alcohol. You don't want to overdo the caffeine. You just want to go along with, you don't want to go along very long without protein. Protein is so, so important for the brain. And you don't want to have those blood sugar swings because it's actually once insulin shoots up, it's not able to push glucose into the cells. So that's another reason why the ketogenic diet is really good for the brain. So what happens is that a head injury activates immune cells in the brain, and that can be compounded. So think about a bucket being filled up. So if you've had mold exposure, gut inflammation, you have Lyme disease or some kind of other infection, this bucket is being filled up, and that can absolutely affect the brain. So if you have these other conditions, having a head injury just makes everything worse. The mitochondria really, really matters a lot. Those are the little engines of each cell, and the brain has a lot of mitochondria. And so that will affect your brain as well. Sometimes that kind of explains why sometimes people have mental fatigue, confusion, light sensitivity, sound sensitivity, irritability, headaches. Sometimes when people use the word "I'm crashing," like, or "I'm flaring," as a way to describe what's going on. So, if someone has, a concussion, it usually affects the gut, and the gut goes off. And so sometimes soon after, you might have constipation or reflux, bloating, imbalance in the microbiome, food reactions, difficulty digesting foods, and all of that can make brain fog worse. So what's really, really important to do is to address those foundations: the sleep, eating, moving your body, but nervous system regulation is probably going to go up as a priority compared to those other things as well. I mean, it's not a magic bullet. None of chronic disease or chronic complex illness is there's a magic bullet for it, but you really have to address multiple things at once. And I don't
Yeah.
know. I'm trying to think if there's anything else, anything you want to add, Vin?
Yeah, I just think that the other piece to add to that is what we talked about a little bit prior is that when we have a traumatic brain injury, the vagus nerve can also be impacted. And
Right.
so when the vagus nerve is impacted or sometimes can get stunted, it becomes sluggish, and we can have some issues with regulating stress, with regulating, blood pressure and heart rate and some of those pieces, but also that then becomes that's where sometimes anxiety can be triggered. It's difficult with difficulty with sleep. So there's some components and interventions that we can certainly do to help firm up the vagus nerve and make it a little bit more resilient, therefore making your brain a little bit more resilient and improve stress and sleep, which will then just kind of keep this cycle of improvement going.
Right. Absolutely. Yeah, and sometimes the vagus nerve needs retraining. There's actually programs that help with retraining the vagus nerve. There's Annie Hopper's program, DNRS. There is primal trust, especially if trauma, childhood trauma is a big piece of it, because childhood trauma actually can exacerbate having that as a baseline growing up with, if you have a high ACE score, adverse childhood event score, getting a head trauma actually compounds those kinds of things. So Primal Trust, I think, is a really good program. It kind of combines the two. And then there's the Gupta program as well, which combines with meditation and mindfulness and breath work. Everybody's different. There's other programs. Those are not the only three. I'm trying to think of some other names, but they're not coming to me right off the top of my head. Can you think of other ones, Vin?
No, I've generally recommended, working with our coach, here obviously at Functional Mind, we have a coach that is specifically trained in
Yes,
somatic
Nancy.
response and,
Yeah,
Vegas,
Nancy
the
Houston
vagus nerve.
John.
Yep. So she's fantastic, and we definitely utilize her as a resource for sure.
Absolutely. She's amazing. There other three questions that we have are from the same person. So we'll try to, and they're kind of all connected. So I'm just going to go to this question. Does having had a case of mono, parentheses, Epstein-Barr virus, so mono is a condition that can be caused by Epstein-Barr virus, make anxiety worse for someone who already experienced bad anxiety before getting it? Also, are there lasting effects on the body, mentally and physically, from having had this? And is there anything that one can do to feel better? Thanks for your time. Okay, um, so yes, the answer is yes. Mono can absolutely make your anxiety worse in someone who already has anxiety. And it's not because Epstein-Barr virus is an anxiety virus, but it's because mono can really knock the body down. It affects people differently, kind of in the same way that the coronavirus or COVID can. Some people have had COVID, didn't affect them at all, and other people, I mean, obviously, we know that people have died from it. These less virulent types of COVID viruses, can cause all sorts of issues. Just like any virus can cause, certain symptoms, and we can identify that particular virus based on that. So, but with Epstein-Barr virus or mono, it's also called kissing disease or something that's common in teenagers. I know some teenagers who had it and they were walking around with it, had no idea, and it just shows up on a test randomly. And others like literally miss all of spring or all of winter, being in bed for days and days and days, not being able to return to school. So it can absolutely cause you to be inflamed, exhausted, not sleeping well, or sleeping too much. A lot of times people with Epstein-Barr virus sleep a lot. They're in bed 12, 18 hours and cannot get out of bed. And so it takes a while for a person to recover from this type of virus. And it's also quite connected. We were talking about the thyroid. It is a trigger for autoimmunity, especially Hashimoto's. So sometimes people who've had Epstein-Barr virus, I'm one of those people, had triggered Hashimoto's thyroiditis, and then ultimately becoming hypothyroidism when the thyroid kind of burns out, which is then compounding the mono. So some people will have, fatigue, fever, sore throat, swollen lymph nodes, and sometimes even spleen or like a liver dysfunction, elevated liver enzymes. Trying to think of what else to say about that. So, I mean, what can you do about it? I think the thing, well, you can obviously do the foundational things that we've talked about before, and this is true for all of functional medicine. You want to get your sleep in order, get your diet in order, cut out the sugar, regulate your blood sugars, optimize all of your vitamins, making sure your vitamin D is good, your thyroid's good, low stress, address any other sources of inflammation like mold exposure. Those are all the basics. They matter a lot. For Epstein virus, particularly in some other viruses, I usually give a combination, and it's best to talk to your provider if you want to do this, a combination of L-lysine, which is an amino acid, and a monolaurin, which is extracted from coconut oil or coconut. And that combination is usually given for about 3 to 6 months, and that can make a difference in bringing the viral titer down. So you'll want to have your PCP or whatever provider that you're working with is to get the full panel. There's 4 values. There's an IgM to see if you have an active Epstein-Barr virus, but there's 3 other IgG levels. And if those levels are 3 times higher than the normal, especially across the board, then you officially have chronic Epstein-Barr virus. And so supplements will definitely make that better besides the lifestyle changes.
Yeah, I think that with Epstein-Barr, the something that's really important as a just a backdrop of that is that it we have to acknowledge that it's a major inflammatory event that occurs, and you
Mhm.
get this massive release of cytokines that occur, and we think of Epstein-Barr sort of in the acute phase. We with the fatigue and the swollen lymph nodes and the sore throat, and that those are sort of the conventional symptoms, but this sort of like latent Epstein-Barr that can cause anxiety and some of the other brain fog and some of those issues. That piece specifically comes back to the inflammatory component, and so things like you were talking about, as far as making sure that we have our micronutrients well balanced and managing stress, exercise, a lot of the basic things that we do as far as, foundational pillars of health are really important to help mitigate the inflammatory component. So with Epstein-Barr, um, oftentimes, the symptoms resolve over a period of time, or the acute symptoms resolve over a period of time. But if we're having these flare-ups that occur, sometimes it's because it kind of comes back to what you were saying about the brain being a little bit less resilient after an event, and there's this underlying inflammatory component because it becomes latent, like like a herpes virus or something. It's always there. It doesn't completely go away. So what we're trying to do is manage and minimize these flare-ups. And some of the ways that we do that is with the foundational lifestyle approach that we talked about, micronutrients that are well balanced, and healthy diet, and of course exercise and adequate sleep.
Right, right. I think so, just to maybe be a little bit more clear, what the goal is not to just make Epstein-Barr virus go away, but really to strengthen the immune system. And when you strengthen the
Exactly.
immune system and change the terrain of the microbiome, then in which 80% of your immune system is your microbiome, it's in your gut. 80% of your microbiome's in your gut, but 80% of your immune system's is in your gut. And guess what? 80% of your neurotransmitters are made in your gut. So our goal is to really rehab the gut, change the terrain so that it basically makes it inhospitable for Epstein-Barr virus to hang around, and it kind of shrinks it, and then your immune system kind of puts it in its cage. Just like if you had chicken pox if you were 8 years old, and then you get older in your 60s, 70s, 80s, you might have this infection or something that then causes shingles to come out. That's because that virus that was in the cage by your immune system came out of that cage. And I'm using that as an analogy. There's no real cage there, please. And so, your immune system declines as a result of some insults. And so that can cause the virus of shingles to come to the surface and wreak havoc in the way that it does. So Epstein-Barr virus can also do that. That's why sometimes people get recurrent Epstein-Barr virus. There's other viruses, by the way, that we look for. There's parvovirus, There's cytomegalovirus that can cause problems that many, and there's HPV. So there's lots of different viruses that can cause just as much damage. And so giving those supplements actually brings all of those viruses, the load down, not just the Epstein-Barr virus. So and there's other treatments as well. If you have a specific virus, we're just kind of generalizing it and also just specifically talking about Epstein-Barr. So can autism, the next three questions are about autism, and the person's initials are ML. So here we go. Can autism symptoms be amplified by chronic environmental illness? Many autistic children have underlying medical conditions. In your experience, how often do environmental factors like mold exposure, chronic inflammation, mitochondrial dysfunction, or gut dysbiosis amplify autism symptoms rather than cause autism itself? How do you differentiate between a child's neurodevelopmental baseline and symptoms that may be medically reversible? I mean, that is a really tough question because, the way you can when you're really, really young, and a child is developing, you're not going to be able to know what the baseline is, because unless you've had a few years and then suddenly there was this change and you just happen to have testing, neuropsychological testing right before that happened, which obviously that would be really lucky, to do something like that, especially if your child's normal and not having any issues. Why would you get neuropsychological testing? So there's really no way of getting that baseline. And so, oops, my alarm's going off. So, it's really a parsing, of having what's the personality of this child. And if you have any idea of this personality, then and you like that personality, or they like themselves that way, then that would be your target symptoms. So it wouldn't be our decision to know what to target. It really would be that person's decision. And I can give an example. I had a patient who had autism for years. He was on 5 or 6 psychiatric medications. He was not, and this was at the age of 14. And his mom was at this place of wanting to put him into a group home because she could not handle him. And I was basically her last resort. It took a number of years, but eventually we got him off all medications. And we figured out through testing and just through his ability to communicate and trying different things, like trying to learn how to drive, and just finding that he just couldn't. He basically had we determined that he had a learning disability, and he just decided, what, I don't want to learn to drive anymore. It's just too much work for me. Perfectly happy living independently, cooking for myself. I've got my friends. I'm happy with my friends. Which was a big issue for him, not having friends. He was working at a grocery store, pushing carts, and he was going to a place where he had a community, and, he was happy with that. And, is he going to go to college? Probably not. But, he created his world, in which he was happy and very independent, and his mom was really happy with that. So, I think some of this gets parsed out as you go through the process of removing those environmental factors that you mentioned. So autism symptoms can absolutely be made worse by the chronic environmental exposures and or medical illnesses. So they don't necessarily cause autism, but that being said, I've had patients, and so everything's on a spectrum. So I've had patients who looked like they had autism, but all those symptoms went away. And including that particular person that I mentioned, that I mentioned to you, talked about earlier, he no longer met the criteria for autism. He had a learning disability, and maybe mild mental retardation, but we have no actual testing to determine that because he didn't have that he's now 21, working with me for 7 years. So he's in a really good place, and that's all he wanted to do. And his mother was happy. So, that's fine. Autism is a neurodevelopmental condition, but sometimes people have symptoms that don't necessarily meet the criteria completely. So they're on that borderline, and maybe it's not autism, it just looks like autism. And so I think the goal would be to eliminate as many symptoms as possible through doing the functional medicine approach, looking for all the possible root causes, addressing each and every one of them, and deciding whether or not you're satisfied with the outcome of where we are. And it may take years. And I think that's what we need to do.
Yeah, I think with autism, number one is unfortunately we don't have a crystal ball
Right.
where we can determine, where they're going to be as they go through the developmental stages.
Mm-hmm.
And so sometimes, and with autism, we start, we can see what we consider, a deterioration where we get like mood or behavioral changes that, start to develop that can be detrimental both to themselves and or the people around them. And so a lot of times it's those environmental factors that can really contribute to whether that deterioration is occurring, and but we don't know where that would have gone initially or anyway. But if we can mitigate those environmental factors, then a lot of times that deterioration will either slow down or dissipate or completely level off, and can return to their baseline function. Another massive component of this, which she talked about in one of her questions, is the gut component. So you have the
Right.
environmental component, and we have the gut component of that. And we see, it's very well documented, anecdotally in case studies and literature, that if we clean up the gut and reduce gut inflammation, we have that gut-brain connection, and that significantly can decrease or dissipate symptoms as well to get that person back to their baseline, whatever that may be. So that there's so many components of autism. Obviously, the diet component, the environmental component, the gut component. There's a lot of different pieces to put that all together, and just make sure that we keep that child or that person on what we believe to be their trajectory.
Right. Yeah. For a lot of autistic children have very high rates of constipation, diarrhea, abdominal pain, reflux. They're restricted in their eating. And so like I mentioned at our open house and my talk about kids, they only eat chicken nuggets and that's it. They won't have anything else. And it's not a choice. I see that as not their choice. I see it as that's what the microbiome wants because it's so severely dysbiotic. Many children with autism have feeding issues. So there are lots of gut microbiome studies that show an association between ASD, GI symptoms, altered microbiota, and you know, but we're still learning so much about this that we don't know if there's causality involved. And so I think it's really important to keep that in mind. I personally think that that it's really the environment and the gut issues and they're all connected. All the causes are connected, the root of the roots, so to speak, as major cause of autism. When we think about what autism rates were when I was a medical student, which was over 30 years ago, it was like 1 in 1,000, and now it's like, I think 1 out of 10. It's dramatically changed. And so what's changed? What's changed is the environment, and the things that are in the environment absolutely affect our gut. And I think it's related to genetic SNPs. So some people just don't have the genetic SNPs to be able to detox these exposures, and some people do. And some people are very specific genetic SNPs that affect the brain. So, but it's too early to say that, technically say that it's these issues that cause autism. And there's certainly no one cause. The other thing that's related to autism is mitochondrial dysfunction. So there's a lot of evidence of mitochondrial disease or dysfunction. About 5% of children with ASD, which have mitochondrial disorders. So and that's higher than the general population. So the next question, it's on the same thread. Is inflammation the common denominator? Many chronic illnesses, including autism, autoimmune disease, mast cell activation, mitochondrial dysfunction, mold illness, Lyme disease, and metabolic disorders, seem to involve chronic inflammation. Do you view inflammation as a central problem, or is it more often a downstream consequence of multiple upstream stressors make response inform? And do you view inflammation as a central problem, or is it more often a downstream consequence of multiple upstream stressors? Okay. So I would say yes, inflammation is absolutely a major common thread. But I wouldn't call it the one central problem in every case. So it depends. So the answer is really, it just depends on the situation. I think of inflammation as like a smoke alarm. And sometimes the alarm is the main problem, but it won't shut off. But often the better question is what keeps triggering the alarm. So that's where, in chronic illness, inflammation is usually the body's response to something going on in the body. And it may be responding to the mold or infection or Lyme's disease or gut dysbiosis or food reaction. So inflammation is the body's response to something going on. But it's not always the root cause. So it's just like a blanket word for the processes that are happening.
Yeah, with inflammation, it's very much become a buzzword,
Right.
and in a lot of ways, it's because there is an inflammatory component that links a lot of these all together. But to speak to your point about what's triggering that alarm, it's that's I think to some degree what's really important is determining what's triggering that inflammation, and
Mm-hmm.
to some degree, there's there's this issue of resilience with each sort of component of this. So some people will have a low level of inflammation and not necessarily be impacted or not be impacted for decades or years uh, until something really triggers it. You have a traumatic event, or you get a virus, or you get like a COVID, for example, and then you start this cascade that just worsens everything. So everybody's degree of resilience, which can partly be genetic, it could be lifestyle impacted as well, will impact your resistance or resilience to these different factors.
Mm-hmm.
Autoimmune conditions. I mean, lots of people get Epstein-Barr, for example, and don't have lingering Epstein-Barr or lingering fatigue as a result. And some of that comes back to their genetic component, their exposures, their environmental situation, and the gut, the health of their overall gut, and micronutrient levels, balance, their hormone balance. So the question is very complex. Is it the root of or the root cause? It can be the root cause of the symptoms, but not what's triggering the inflammation in of itself. You might have something that's causing inflammation, and the inflammation is causing the symptoms, but you have this cycle. So we have to kind of come back to some of what the root cause is of all of it.
Right. So just to circle back to autism, I mean, because we're going to be winding down and ending today's session, which I thought was amazing, so I think we covered a lot today. But just to say that autism is a combination of the child's wiring, and that wiring could be their personality, how they think, their IQ, their likes and dislikes. It's basically who they are, but the information that we just discussed is a signal, and what's triggering that is mold, gut problems, poor sleep, pain, mitochondrial stress. They can turn up the volume. And so sometimes when we clear the fog by removing these things, what's left is the child and their wiring. But that wiring is going to have, just like a computer hard drive, when you fix the wiring of a computer, the soft drive is more responsive, and maybe it doesn't show personality, but as a computer, but it just works more robustly overall. And so that's where you see the child shine. So yeah, I think we did a great job, on these questions. They were excellent questions. I was so pleased to see that people responded to them, and we'll hopefully have this video out tomorrow and on YouTube, and we'll, send out another email for the next set of questions for 2 weeks. We'll be doing this every 2 weeks, everyone. I think it was did we decide on the second? Is it the second and fourth Thursday at noon of every month?
Awesome.
All righty. Take
This
care,
was
everyone.
fantastic. Thank you so much for having me, and can't wait to work with you.
Yeah, great. Thank
All
you.
right. Take care.
If you like this episode, please click the like button and subscribe.